So I found that costing's been really useful in developing service pathways, developing new services, because without costs you don't really know the value of the service and whether you're adding value. So if you think about value as clinical outcomes and effectiveness divided by cost, if it's high cost but sort of poor outcomes, then it's a low value service. So knowing about costs helps you understand the value of your service, and equally if you're writing a business case, then it's going to be scrutinised, and so you need to know the costs if you're going to develop a service or know whether you're adding value. So yes, I've found it to be useful.
Without knowing what you're spending, without knowing what your income is, then it's very hard to build any sort of a business case, and it's also hard to deliver the best quality of care. And of course, knowing the costs allows you to develop the best sort of care pathways. As a clinical director with a large budget of over 40 million, it was important to know the spend and where I could use that money more wisely. And I have several examples of actually using that money and knowing what the income was, knowing what the costs of what I was doing to allow me to build appropriate business cases. And that's allowed me to develop services in my locality.
The finance or the costing question has to be part of medical decision making. As doctors, we make the decisions that, if you like, consumes the money that is spent. So it's part of our responsibility to know what we're doing, because we are the stewards of that money. So yeah, I think it's really important that finance plays our role, and understanding the costs of care and treatment plays our role in decision making. It's not clearly it can't be the only component of decision making. But it has to be a component. I think something that does resonate with clinicians and anybody, I would hope, is reducing waste. And so if you're spending more, your costs are higher, and they don't need to be that high, why would you want to do that? So understanding costs is important to reducing waste. Accurate costing allows benchmarking to occur, and again, it's why should there be unwarranted variation with one department providing a certain pathway of care, another department providing another pathway of care, and the cost being vastly different. So I think the costing work is really important.
And if we've got an accurate cost base, then it allows us to compare for different procedures, different investigations, different outcomes across different organisations. So I think that level of benchmarking, as Sanjay has said, is really quite an important marker of looking at how we can use the costing information accurately.
Use things like PLICs to look at unwarranted variation in other things. So for instance, length of stay. So actually when we were doing these PLICs workshops, it was really interesting. We had one foot and ankle surgeon come to one of the sessions, and the first thing he did was compared his length of stay to his mate's length of stay, who's the other foot and ankle surgeon, and he told his mate that your length of stay is higher than mine when he got back to the office. And then sure enough, the next session we did, the other guy booked on to learn about how we could get this data and wake it. And actually their length of stay may have been warranted. It might have been different for a specific reason.
When I was clinical director of cardiology, we had 5 interventional cardiologists, and they all used 3 different stents. So we had 15 different stents which were used. We sat down, we discussed it, we rationalised that down to 3 stents. We got agreement, and we saved thousands of pounds by reducing our stock and using just a set number of stents. So I think having that knowledge of what the cost is, displaying that back to clinicians with the benefit, gets their buy-in.
With the PLIC system, a surgeon can count up all their operations that year and use it for their appraisal. You can use PLICs to do lots of other things, infection rates. So the PLICs is just a front end of many different hospital systems.
But if you want information about what you do, I think it's going to your business manager, asking that appropriate information, and if they can't find it, it's escalating it up. And if you want the bigger picture, then I think going to the society, to the college, or particular areas such as the Getting It Right First Time work streams where that level of information exists.
So within the Future Focus Finance programme, we've recognised that most clinicians know very little or nothing about finance. So we've encouraged every finance department in every NHS organisation to identify somebody in the department called the FACE Educator, Finance and Clinical Educator, to get out there and speak to clinicians regularly.